afternoon, everyone, and welcome to today's presentation on preparation for remote assessment. So as Sherry said, my name is Daniella Maglione, and I'm a National Senior Clinical Consultant with Pearson. And with me today are my wonderful colleagues, Chris Huzenic and Laura Moreno. Today, we are offering APA-CE and NAS-CPD for today's hour-long webinar. In order to ensure that you receive credit, please be sure to attend the entire session. And when the session has terminated, please fill out an evaluation form and submit it to Darlene Davis. So on the form, please indicate if you'd like APA, NASP, or credit for both. As I mentioned earlier, once the evaluation form is complete, please send it as an attachment to Darlene Davis at Pearson, no later than the 15th of October. We ask that you please do not snap a photo with your camera when sending the form to Darlene. Please note that partial credit will not be awarded. And also, please allow 12 business days for delivery of your APA or NAS certificate. Financial disclosures. To all presenters for today's webinar are employees of Pearson. There are no non-financial disclosures. Also, please note that Pearson is the publisher of many of the assessments and platforms discussed today during today's presentation. Today's webinar is the second in a series of webinars that address telepractice. We're going to have a 1 hour, 30-minute long webinar that analyzes task demands when planning for remote assessment on October 15th. That is going to be presented by Dr. McCoo, and another one on the 21st of October that discusses the Weschlers by Dr. Rayford. So please note that this is the second in a series of webinars addressing telepractice. Learning objectives for today. Number one, identify environmental factors that need to be addressed with examinees and families prior to administration. Two, list hardware technological factors that need to be considered with examinees prior to administration. And three, explain factors for examiners to consider when planning for remote assessment. Before we begin, we need to point out that today's presentation is intended to support professionals that are obviously making decisions around remote assessment. This information is not comprehensive and should not be interpreted as a requirement or recommendation to conduct assessment via telepractice. As always, we recommend that professionals follow best practices and ethical codes, telepractice regulations, and legal requirements at all levels, and that they develop competence for teleassessment via practice. Please use your own clinical judgment when determining if teleassessment is a viable option for a particular examinee, referral question, and situation, as there are times when it may not be recommended. Please see Pearson's permission and licensing by clicking on the link for Pearson's letter of no objection. Permission includes the use of non-public facing screen mirroring and screen sharing methods. It is not intended to allow for the use of photocopying, scanning, or duplication of test record forms or response booklets. Permission does not allow for any modification to the original test content. So, as Sherry mentioned earlier, if we do not get the chance to answer all of your questions during today's webinar, please see our Staying Connected page through our Telepractice homepage, or use the link above to connect with someone so that you can have all questions answered. If you're participating during today's webinar from Canada, many of the resources are available on our pearsonclinical.ca/telepractice page. We would like to encourage those individuals to please visit that page as your primary source of information. And if, like me, you are a fan of the Wiley Essentials series, please note that they were going to have a book that is going to be available this November that addresses psychological teleassessment. And as I mentioned, that it should be published sometime next month. I'm going to now turn it over to Chris, who will be reviewing the agenda. Thank you.
Thank you, Daniella. All right, in today's webinar, we are going to look at what is telepractice, telehealth, or teleassessment, some of the definitions from some of our professional groups. We're also going to look at some of the guideline and requirements and recommendations from those groups. Then I will be discussing some of the things that we recommend that you do prior to assessment day. Daniella will then discuss what some of our recommendations and suggestions of what to do during assessment day, and then also about report considerations. Laura will be discussing Q Global and Q Interactive as platforms to be used virtually. And then finally, we'll talk about resources, and then if time permits, we'll have a question and answer session. All right, so the first section that I'm going to talk about is guidelines and requirements. On the Pearson Telepractice page, under the How To tab, we have lists of, PDFs that you can download from and links to professional organizations that can provide this information. These organizations have collected and collected information on telepractice and how to do how to conduct business virtually. If you are in Canada, you can collect similar information from the Canadian Psychological Association at the link shown here. All right. So first, we're going to talk about what is telepsychology. APA provides, at this link, provides a definition of telepsychology. Telepsychology is defined as the provision of psychological services using telecommunication technologies. Telecommunication technologies include, but are not limited to, telephone, mobile devices, interactive video conferencing, email, chat, text, and internet. The information that is transmitted may be in writing or images or other data. Communication can be synchronous. That means there can be multiple parties involved, or it can be asynchronous, in which information is placed on a bulletin board or a resource page. Okay, NASP also provides information about telehealth. You can see the website in which they provide a definition of telehealth. And in their definition, telehealth is defined as any school psychological service that is being provided remotely, that is without being in the same physical space as the individuals who are receiving service. It is permissible under NASP's ethical standards to provide services remotely that an individual has the skills to deliver face-to-face, so long as the particular practices are appropriate or appropriately adapted for this delivery modality. All right, NASP also provides a suggestion that there will not be a one-size-fits-all response to the various situations. And we know this as we have engaged in telepractice, and I'm sure all of you do as well. There's a great deal of uncertainty and anxiety. It is really suggested that you use an ethical lens when looking at each situation. So use your best clinical judgment when engaging in telepractice. Okay, NASP also provides a list of COVID-19 resources. Consider your competence and the best interests of your student. For example, if evaluations are to be conducted remotely, they should be conducted through platforms specifically designed for that purpose. You should consider assessment measures carefully. Practitioners must consider their own training needs and the needs to develop clear procedures for special delivery in this manner. Training will also be needed for adults who are asked to assist the student at home. So if you're using a facilitator, potential validity issues may be addressed when assessing and taking place in a time of anxiety for youth, their family, and caregivers. You should note and keep that into consideration when you're doing the assessment. Also, make sure that when you're doing telepractice assessments, that emergency response plans are in place if the student feels threat or is threatening to harm themselves or others. All right. Some other NASP recommendations and concerning assessment and evaluation. NASP recommends that assessments must be administered in the manner in which they were developed and validated. If adaptations are made for remote administration, there must be evidence to support those adaptations, and any such adaptations need to be documented in the evaluation report. Assessments should be administered remotely only on platforms designed for that purpose. Although rating scales and interviews and possibly home-based observations could be conducted remotely, it is important, again, to remember that students' behaviors during this time of the COVID crisis may not be typical, and that you should use your clinical judgment in interpreting any reports. All right. NASP has also asked, NASP also provides, they provided some more updated recommendations. Some reevaluation decisions can be made based on data available prior to the school closure. School psychologists should carefully consider whether there is sufficient evidence to support this. If the evaluation or reevaluation cannot be completed safely, ethically, and/or legally, school personnel should communicate with parents about this and request extensions to timelines, especially when you're dealing with or addressing or supporting special needs students. NASP provides a webinar, an Ask the Experts webinar, wading through a sea of ambiguity, charting a course for special education services in the pandemic. That is very useful. Okay, it's important to collaborate with families during telepractice. You need to ask families what they need and be respectful of their responses. NASP also has a webinar, an Ask the Experts webinar, that addresses this, some strategies for engaging and supporting parents during the pandemic. You should provide encouragement and assist families in problem solving. Let them know you care and that they aren't expected to know how to do this perfectly or even well. When working with colleagues, you should develop strategies for connecting with students and families that are not participating in remote learning activities. You should be sensitive to multiple demands on students and parent caregivers during school closures and keep expectations reasonable. Parents are going to be working as well as working to help their children in remote learning situations. Our high school students, they may have a role providing care for older parents or grandparents or younger children in the home. Also, school psychologists should consider when working with schools or district web teams to get them to add a website where available resources are in case emails do not get through to all of the parents or caregivers. Okay, we recommend that you practice with platforms by using them multiple times to get comfortable with them before doing your assessment. We also recommend that you grab a volunteer to sit through an entire test administration. And then that before any assessment that you schedule a meeting with the family to plan the assessment prior to that assessment day. Now, we also know that no matter how much effort is done prior to the assessment day, sometimes things occur that that interfere with the assessment, and we recommend that if things like that do occur, that you do postpone the assessment. All right, so you should keep in mind that there are many teleconference platforms available for use, and they have many different features. So use the platform that works best for you. That in doing a telepractice session, that you need to protect the security of the assessment, as well as the privacy of the student. But you can get many resources to help you do this, and some guidelines from NASP and APA. Also, we have, again, a Telepractice page at Pearson that provides many of these resources and guidelines on how to use assessments in Telepractice. You can go to the Pearson customer service and request a Q Global account or demo if you want to use those platforms in the telepractice process. All right, in the previous webinar that we did last week, we showed folks how they could navigate the Pearson Telepractice site. And in this one, again, we're taking a deeper dive. One area of focus that we're going to look at is on the web page in the Pearson, under the resources, under the section Pearson Tips and Tricks. All right, under this, under resources and under tips and tricks, there are several different recommendations and guidelines and PDFs, and as well as videos that you can use to help you in telepractice. In this session today, we're going to focus on remote administration preparation, and so we'll be talking about the preparation letter. We'll also talk about some special considerations for scoring. And then we'll also talk about remote assessment setups for examiner and the examinee. All right. In the this next section, I'll be talking about providing some suggestions and recommendations on what to do prior to assessment day. All right. Some of these recommendations include developing a checklist to help make some decisions on how to set up prior to the assessment. So you will ask some questions like, which platform are you going to use? Have you practiced and developed competency in using that platform? Which assessments will you use? Will I be using Q Global or Q Interactive or a combination? Have I had a conversation with the parent or caregiver to determine if the remote environment is supported and the conditions are for a positive remote assessment experience are in place? Will I need to train a facilitator? Does the student have or the caregiver have a digital device that can be used in the process? All right. As we continue with this checklist in terms of getting prepared, you need to determine whether our suggestion is that you need to determine whether you will deliver any rating scales or on-screen or remote on-screen assessments. So basically, what's the delivery method that you're going to use? You need to determine if you need to send materials to the examinee earlier before the assessment day, such as response booklets. You also need to determine if you need to provide guidance to an on-site facilitator that can help set up the environment, set up technology, provide student support, and manage materials. All right. Continuing with preparation, you should ensure you have the necessary materials on hand at your location to conduct the assessment, that you have an internet connection, that you have any record forms or iPad if you're using Q Interactive, that you have administration manuals handy if necessary, that you have a digital or paper response booklet. Then you should make sure that you've scheduled the meeting and develop a plan for the student to access the remote session and send that with an invite. Okay, in terms of choosing a platform, Pearson gives guidance on choosing a platform on our Telepractice page. We don't recommend any specific platform. Again, you want to select a platform that meets your needs. Okay, you can see here where this is available on the Telepractice page. Also, there is a third-party site called Private Practice that we have found that provides a very good comparison of different platforms. All right. All right. Then hold on. Sorry, tech problem. All right. Pearson also provides information on our Telepractice page on choosing an assessment. This is going to be under the products section of the Telepractice page. You can then choose your assessment, your specific assessment. What it provides is a guidelines on how to use that assessment in the Telepractice environment. It includes recommendations for the audio-visual environment, some suggestions about examiner factors to consider, examinee factors, test material factors, and then other miscellaneous factors. Then if you want more information, so prior to the assessment day, you can go to the how-to section again. And under the how-to section, you can select before conducting your assessment, and this will provide guidance. It'll talk about what to do before conducting your first assessment, practice the administration, identify appropriate candidates, provide the facilitator with information, do basic troubleshooting, practice, practice, practice. So in terms of a facilitator, we also provide a guidelines on the Telepractice page based on the different types of assessment. So what do you need to train the facilitators in terms of questionnaires, verbal only tasks, verbal visual tasks, and complete tasks. I'm sorry, complex tasks. Then you want to take special consideration if you are assessing young children, because you're going to be working with parents. Anytime a parent is assisting, expectations for participation need to be discussed in detail in a pre-meeting. Some tests require a lot of participation from parents, and some tests do not. Okay. All right, and then finally, on the Pearson Telepractice page, as I'd mentioned earlier, we have a hello examinee letter. It's a template that you can print out and that you can email to the client or the student or the student's caregiver prior to the Telepractice assessment session. All right. All right. In the next section, Daniella is going to talk about what we do on assessment day.
Thank you, Chris. So we're going to talk about what assessment day might look like now. As a view, this is an illustration of what setup for the examiner might look like. Please note that examiners can have up to 2 screens. Screen 1 would allow for face-to-face communication and display of testing materials, a monitor with a webcam and speakers and microphone are recommended. Screen 2 is placed by Screen 1 to assist with viewing of additional administration materials, such as a digital manual as an example. A cell phone, a tablet, or an additional computer can be used for this purpose. As a view, this is an illustration of what setup for the examinee might look like. So examinees can have up to 2 or 3 screens, depending on the task administered. Screen 1 would allow for face-to-face communication and display of testing materials, a monitor that measures 9.7 inches diagonally across with a webcam and speaker's microphone is recommended. Screen 2, as noted by the little iPad or camera in the picture, is placed to the side of the examinee, and it should be pointed at Screen 1. The purpose of this camera is to capture pointing responses. A cell phone or a tablet can be used for this purpose, and Laura's going to show you a picture later on that will depict this. Screen 3 is placed to the side of Screen 1, depending on whether the examinee is right-handed or left-handed, to view the examinee's written responses. A cell phone, a tablet, or a document camera can also be used for this purpose. Before beginning the assessment, we recommend that you first confirm that the home testing environment is available and free of distractions, such as TV, pets, cell phones, or any other instrument that makes noise. Then please take a note and determine your assessment order. One recommendation is to group tasks that are similar to reduce the number of transitions, so that in this manner, you would group subtests that require similar camera viewpoints together. You would also ensure that you have all the necessary test materials to include the examiner manual, whether it's digital or paper form, and response booklets for demonstration purposes. Ensure also that you have strong Wi-Fi connection and that your technology is fully powered, especially if you're using a tablet, iPad, or laptop. You want to make sure you also test video and audio and ensure that you have good lighting to ensure that the examinee can fully see your face. If you're going to be using an iPad, please check the level of brightness under settings. Eliminate any visual distractions on your end, like fans, phones, etc. And then make sure you turn off your device notifications. And last but not least, make sure that the cursor is easy to see and is not flashy. When you start the assessment, you want to make sure that you disable the recording on the platform for the examinee as well before launching the meeting. You want to make sure that you confirm the examinee's name, location, and a phone number. Now, depending on the examinee's age, you may also want to ask for the facilitator's phone number to assist with any issues as they come up. Sometimes it helps to have the examinee give you a visual tour of their surroundings to ensure that the testing environment is appropriate. Like, for example, having a table and a chair that does not have wheels. You want to make sure that you address any distractions and need for privacy at that time. You also want to ensure that you can fully see the examinee's face and perform, once again, audio and visual checks. And then for the second camera, include turning off the sound to prevent any feedback. You want to also confirm that all test materials are available for the examinee, to include scratch paper, a pencil without an eraser, and a response booklet if applicable. And then if the keyboard is not needed, it is recommended that you remove that to reduce the number of distractions. Review the assessment process and allow the examinee or facilitator the opportunity to ask you questions. And then once that is done, you would then commence the assessment. During the assessment, we want to make sure that we'd recommend that you adhere to your plan as much as possible. We'd like for you to provide periodic check-ins and breaks as needed, and obviously this might occur more often with younger examinees or individuals who have a short attention span. Provide advanced organizers also when transitioning so the student knows what tasks are going to be coming up. And as always, you would focus on rapport and assessment. Make sure that you always share stimuli in full screen mode because, as we mentioned earlier, the stimuli should be displayed at least 97 inches across when measured diagonally. Remove any thumbnail images off the stimuli and document any tech issues or distractions that are noted during the assessment. Last but not least, know when it's time to call it. If you encounter many issues or difficulties, then you would pause the assessment and determine a game plan. In terms of response options, mirroring obviously is going to need to be enabled on the teleconference platform. As I mentioned earlier, an additional camera or cameras may be needed depending on the task that is administered. You can use pointing or annotation tools that include writing tools, highlights or cursors, etc. And then, of course, many times there are numbered or lettered items. And I'm going to be giving an example here coming up fairly soon. I do want to emphasize that a parent, facilitator, or caregiver cannot be used to provide responses on the student's behalf. And obviously, this should be explained to the facilitator ahead of time before the assessment begins. During the interview, take notes and maintain nonverbals just like you would in person. During WrapUp, of course, you would address any questions that come up. You would then prompt the examinee or facilitator to log out, and then remind the examinee or facilitator, once again, depending on the examinee's age, of the self-addressed stamped envelope if you're going to be using a response booklet, and then log out of the platform. Of course, when you're discussing results, discuss methodology and its impact on reliability and validity, just like you would in person, and follow task-specific guidance for administration and results. As an example, I'm going to share with you the directions of the WISC-5 picture span subtest. If you look down below at the last bullet, you're going to see that the administration manual states that the examinee must indicate their response by pointing or by saying the letters of the selected response. If the examinee names the pictures, you would then say, "Show me." So if the examinee names the pictures rather than providing the letter or pointing, you would certainly need to address that modification in your report. Let's talk about special considerations for score interpretation. So this excerpt is taken from the WrapUp assessment manual, which provides guidance for various situations to include times of educational disruption. This guidance, however, can be applied to all achievement tests and not just the WrapUp. We have received a lot of customer feedback asking whether it's appropriate to use age or grade spade norms, and I hope that I'm able to provide some clarity into this question. So when you're determining whether to use age or grade-based norms, you need to really look and consider 4 different factors. One is how age and grade-based norms differ, which I'm going to explain further. The second has to do with the academic areas that are tested and how the results will be used, and I'll talk about that further too. The third revolves around demographic characteristic and educational history to include, obviously, previous MTSS data. And then, of course, last but not least, summer testing. Okay, so let's talk about the advantages of each. So the advantage of using age-based norms is that the results can be compared to other age-based tests and reflect the skills of the examinees who are young or perhaps even old for their grade. However, they mix examinees with different amounts of curriculum exposure. The advantage of using grade-based norms then is that they reflect curriculum exposure by trimester for each grade level, but obviously these are less representative of examinees who perhaps are young or old for their grade. Please note that both grade and age-based norms have comparable reliability and validity. Both set of norms have shorter time intervals at the earlier grades and age levels when achievement progresses more rapidly. So take a look here, age-based norms, obviously taking a look at this table 3.5, takes a look at key factors that need to be considered when deciding whether to use age or grade-based norms, right? So use grade-based norms whenever you're looking at an examinee and they're out of age for a level or an eval that focuses specifically on CBM. You want to use age-based norms when comparing results to other age-based measures like ability, or when testing adults or adolescents, obviously, who've exited high school. At times, you may want to use both grade and age-based norms, as I mentioned earlier, for examinees who may be old or young for their grade, have been retained, have been afforded with advanced grade placement, or have experienced a significant educational disruption. So when we're talking about COVID, you may want to look at both age-based and grade-based norms. All right, so age-based norms compare an individual to others of the same age. However, it goes without saying that individuals of the same age can be in different grades and obviously, therefore, have different exposure to curriculum. For example, a 6-year-old may be compared to another 6-year-old in kindergarten and in the first grade. You want to make sure you also consider the time of testing as well as the student's date of birth. So for example, a student that is tested towards the end of the school year can be compared to others of the same age who are in the same grade or one grade higher. Now, for grade norms, they compare examinees to peers of the same grade and trimester, so obviously curriculum exposure is more consistent. But obviously, peers in the same grade can vary by age, especially when we're looking at the upper grades, and we're talking specifically about high school. As an example, I'd like to use my son, who is in the 9th grade and is currently in a geometry class, but he's in a classroom where there are 16 and 17-year-old students. Because math depends heavily on grade level placement and curriculum exposure, we may recommend that grade-based norms be used when evaluating math skills. So I hope that makes some sense. And then, of course, last but not least, both set of norms, as I mentioned, have shorter time intervals at the earlier grades, age levels, because achievement obviously progresses more rapidly during that time. So in the end, please consider all of the factors discussed here when determining whether to use age or base grade norms. In terms of recommendations for report writing, we want to make sure that you include a statement about the test being administered via Telepractice and the method of Telepractice that was included. And I've included an example here for you to look over as well. You want to make sure that you make some sort of clinical judgment regarding whether or not the examiner was able to obtain the examinee's best performance in the document, just like you would during in-person testing, and include comments on factors that led to the decision to conduct testing via Telepractice and to report all or not report scores. So this is a question that we get quite frequently, and really this is a clinical decision that needs to be made by the examiner. We want to make sure also that you record any and all atypical events during the testing session, and their impact on testing results. Provided that the examiner has thoroughly considered and addressed the factors and the specific considerations as listed above, the examiner should be prepared to observe and comment about the reliability and validity of the test results via telepractice. Include also whether a facilitator was utilized and if that facilitator was trained or untrained during the assessment to assist, and if they were present throughout or only assisted with setup. And then last but not least, indicate that the student, their personal circumstances, and the available testing environment and technology were appropriate for testing in this modality and at this time. No matter the circumstances, in assessment, this context requires wise interpretation like all other matters. In terms of research studies, there are two recently published results that may be of interest to many of you. The first is a home-based pediatric teleneuropsychology validation study. This is an equivalent study of individuals who were tested at home using parents facilitating. Note that a quiet workspace was provided in the home, and the parent facilitator only helped with the setup and then actually left during the test session. The caregiver was asked to provide their phone number so that the examiner could contact them in case they were needed during the session. And a sealed envelope method was used. This study did include examinees ages 16 to 20 with pediatric demyelinating disorders. At the conclusion of the video conference session, the caregiver did return to the room, and the participant and caregiver were instructed to seal the envelope with all of the materials inside and return it by mail or at their next scheduled visit. The second study here, equivalence of remote digital administration and traditional in-person administration of the Wechsler Intelligence Scale for Children, 5th edition. Boy, that was a mouthful. And this study addresses the question, can you apply current normative and psychometric information from the traditional in-person test development to the remote online format? Note that an N of 256 children of ages 6 to 16 was included. 90% of these children were tested in their homes and did require the use of a lightly trained facilitator. So lightly trained means approximately 10 minutes. They dropped the blocks for these young children during block design to ensure, of course, that they were scattered, and they ensured that they were connected and opened the response booklet, and the facilitator did remain in the room. So I've provided the link for all these different research studies if you want to look into these a little further. I'm going to now turn it over to my colleague Laura, who will be discussing our two platforms, Q Interactive and Q Global, in greater detail. Laura?
Thank you, Daniela. Okay, let's take a look now at using Q Global and Q Interactive in a telepractice setting. First, let's take a look at Q Global. In Q Global, you have the ability to administer questionnaires such as the BASC-3 and the Vineland. You can present the questionnaire through an on-screen administration or through a remote on-screen administration. To use the on-screen administration, the process would be to launch Q Global, and after assigning the rating scale to the examinee, select the on-screen administration option. Then you would share your screen within the video conference so the examinee can read the items. You will need to decide how you will capture verbal responses and if the examinee will have the option to take control of the cursor and click through the rating scale while you observe and facilitate. The next option here is for remote on-screen administration, and this is the method that allows you to email a secure URL containing the rating scale to the respondent. You would launch Q Global, and after assigning the rating scale to the respondent, select the remote on-screen administration option, and then click to send the invitation to the examinee. You would then instruct the examinee to locate the email and launch the assessment. And if appropriate, you could ask the examinee to share their screen with you. The examinee would complete the rating scale while you observe and facilitate if necessary. For assessments that require visual and verbal stimuli and responses, for example, subtests within the WAIS-4 and the Wyatt-4, where the examinee views the stimulus and provides either a verbal response or points to the response, the examiner could screen share stimuli from the digital stimulus book and provide verbal directions using the cursor when needed to point to the stimuli. The examinee could provide a verbal response or use a cursor, annotation tool, or point to the response, and an additional camera may be required at the examinee's location to view the pointing response. The examiner would record responses on a paper record form and either hand score using digital or print manuals or score using QGlobal. All right, let's talk about tests that require written responses. For example, subtests within the WAIS-4, Wyatt-4, Self-5, and this is where the examinee views the stimulus and provides a written response. The examiner would first coordinate with the facilitator or examinee as appropriate, and for these assessments, the examiner would have previously mailed to the home the response booklets in sealed envelopes with directions not to open until the on-screen session has begun. Now, during the on-screen session, the examinee or facilitator opens the sealed envelope and holds up the response booklet, allowing the examiner to confirm the necessary test materials are available. The examinee or facilitator would launch a document camera or other second device to allow the examiner the ability to observe the examinee recording responses in the response booklet. The examiner would use permissible screen capture practices to secure responses for scoring, and that would be pending the return of the response booklets in the mail. And please note that this must be done by the examiner or a professional facilitator only. The examinee or facilitator would place the completed response booklets in a self-addressed stamped envelope while on screen, and then mail the envelope to the examiner after the assessment. Finally, here we have for tests that require manipulatives, for example, the WAIS-4 figure weights or WISC-5 block design, to consider substitutions. Please follow the Telepractice guidance document for this specific test, which can be found on our website. Okay, here is an example of using digital resources on the QGlobal platform. For this example, you would first open the administration directions or verbal stimuli on your phone or a second monitor to view the directions or verbal stimuli during the assessment. Next, on your main computer screen, you would open the digital stimulus book, enable full screen mode, and share the screen with the examinee. For pointing responses, the examinee could use annotation tools, for example, a mouse cursor to identify an answer, or use a second camera at the examinee's location, allowing the examiner the ability to view the pointing responses. Then you would record responses on a paper record form. All right, let's move on to Q Interactive, which is our comprehensive digital system that uses 2 iPads to administer and score assessments. Here we can see an example of using Q Interactive in a traditional face-to-face setting, where one iPad faces the practitioner, providing the ability to control stimuli and score responses. And the second iPad, we refer to as the client-facing iPad, faces the examinee, allowing them to view and respond to the test stimuli. However, in a telepractice setting where the practitioner and the examinee are in 2 different locations, both iPads would be placed in front of the practitioner. So let's take a look at a few options that would allow you to use Q Interactive in a telepractice setting. In this first of 3 options we will review, you could join the video meeting on your computer and on the client iPad. The steps for this are as follows. You would create the assessment in Q Interactive and send the assessment to your iPad ahead of time as always. Then you would log into the video meeting platform on your computer as the host of the meeting. Next, you would log into the meeting platform from the client iPad, So you would have joined the meeting on your computer as the host and also on the iPad as a co-host of the meeting. Then you would be able to share the stimulus image directly from the client iPad in the meeting, allowing the examinee the ability to view the stimulus image. A second camera would be set up at the examinee's location, allowing you the ability to observe pointing responses. And throughout the assessment, you would document the examinee's responses either by selecting the response on the client iPad, or you have this functionality on the practitioner-facing iPad as well. Finally, you would record scores, verbal responses, take notes, etc., on the practitioner-facing iPad. Now, to provide a little more clarification on the process, you would send a meeting invitation to yourself at a second email address, and then join the meeting from the client iPad. Then from the client iPad, you could select to share your screen in the meeting so the client can then view the stimulus image. Okay, let's discuss a second option where you could mirror the client iPad to your computer screen using a mirroring application. To do this, you would create the assessment in Q Interactive ahead of time as always. Then you would mirror the client iPad to your computer screen using a mirroring application. An example of this type of application would be Mirroring 360 or Reflector 3. Then you would enable screen sharing in the meeting platform to share the stimulus image with the client. You would log into the video meeting platform on your computer as the host of the meeting. And then a second camera would be set up at the examinee's location, allowing you the ability to observe pointing responses. You would document the examinee's responses either by selecting the response on the client iPad or the practitioner iPad. And you would record scores, verbal responses, again, take notes, etc., on the practitioner-facing iPad. So in this example, you would use a mirroring application to mirror the client iPad to your computer. So the stimulus image shown on the client iPad would then be displayed on your computer screen. Then you would share your computer screen in the meeting, which would allow the client the ability to view the stimulus image. All right, here we are at our third and final option here that we're going to review, which is where you would use a combination of the Q Global and Q Interactive platforms. Now, this option might be most beneficial for DALS users who have unlimited use of the digital assessment library on Q Global and Q Interactive. For this option, you would open the digital stimulus book within Q Global and share the stimulus book on your computer screen, and then use the Q Interactive practitioner iPad to record responses. So the difference here from the previous two options is that you would be sharing the stimulus images from the digital stimulus book located in Q Global rather than from the client-facing iPad. To do this, you would create the assessment in Q Interactive and send the assessment to the iPad ahead of time as always. Then you would launch Q Global on your computer screen, open the digital stimulus book, enable full screen mode, and share the screen with the examinee. A second camera would be set up at the examinee's location to observe pointing responses. You would document the examinee's responses on the practitioner-facing iPad, and you would record scores, verbal responses, and etc. on the practitioner-facing iPad. So for this example, you open the digital stimulus book in Q Global, click to enable full screen mode in the stimulus book, and then share your computer screen in the meeting platform. Then you would document the examinee responses as usual on the practitioner-facing iPad. Finally, here's an example of the examinee's point of view during the testing process, where a second camera has been set up using household materials. Here they have an iPad being used as a second camera, propped up on a stack of books in a position that allows the practitioner the ability to view the examinee pointing to indicate their item responses. Here we have a list of helpful links to reference. The first is the link to our Telepractice page, which contains many resources to help support your telepractice needs. Here you will find how-tos, information on using specific products, administration tutorials, and a newsroom with updates, news, and announcements about the latest developments in telepractice. Next, we have links to the Q Global and Q Interactive platform pages, which are the two platforms we just reviewed. There's also a link to remote screening for child mental health, behavioral, and emotional risk. Additionally, here we have links provided related to the administration of the WAIS-4 and WISC-5 remotely, digital assessment with Q Interactive and Telepractice, using Q Global to access digital materials and administer assessments in telepractice settings, a deep dive video on second camera hack ideas, and conducting remote assessments for ASD using the Vineland 3. Okay, at this time we like to ask, what did we miss? We thank you for submitting your questions in the chat function of this webinar. And thank you to my colleagues for responding to as many questions as possible. We will follow up on any questions submitted after this session. I would like to ask that you also consider using the Contact Us form on our Telepractice page. Here we have an image of the Telepractice page located at pearsonassessments.com/telepractice, where in the Contact Us field, you can select to contact an assessment representative, ask a question, and an option to sign up for telepractice emails to receive news and resources surrounding telepractice. Finally, as always, there is so much more to learn. Please find out more about us at pearsonassessments.com and join us as we continue this educational pursuit. Again, we will follow up with any questions submitted in the chat box that we were not able to get to during the session. And we also encourage you to contact us with any questions you may have after this webinar. We do have just a couple of minutes here before we wrap up. I'd like to reach out to my colleagues to see if there are any questions that they would like to address to the group. Okay, well, it looks like we have everyone responding to questions right now. And again, we will reach out to you for any questions that we weren't able to get to during this time. So I'd like to thank you, everyone, for joining us today. Take care and stay safe.